Hi, thank you for your interest in ASAP Pathway. I'm Michelle Weddle, and I invite you to join me in taking a preview of our ASAP Pathway library. Now, as Stacy has mentioned, ASAP Pathway is a completely online study club and mentorship program. And as such, all of this is at your disposal on demand whenever you want, and to access and listen to while doing whatever you want. So let's jump in. When you go into the ASAP library, you're going to find 4 modules, which is the heart and soul of our ASAP Pathway knowledge base. Module 1 is Screening, Diagnosis, and Risk Assessment. Module 2 is Interventional Strategies. Module 3 is Advanced Interventional Strategies. And Module 4, which is Case Acceptance, Profitability, and Referrals. Module 4 is also very fondly known as Taking Pediatric Airway and Sleep from a very expensive hobby to a profitable center into your practice. So let's jump in and look at Module 1. When you click here, you'll find lessons. And the lessons are presentation style lessons. And they range from anywhere from 15 minutes to a little under an hour. So we keep it to a little under an hour so you can digest it in small chunks. And you'll see that the time is here, so you'll know how much you can fit into the time that you have allotted. And here in Screening, Diagnosis, and Risk Assessment, we take you from the very basic knowledge of pediatric sleep and obstructive sleep disordered breathing, and talk about that and screening. So you'll have physiology of sleep, pathophysiology of sleep, epigenetics, development of the orofacial region, understanding ENT guidelines, communicating with medical colleagues, knowing comorbidities, how sleep, pediatric sleep and airway issues are diagnosed, going over sleep studies and how sleep studies are performed, and how to read a sleep study, all the way to screening questionnaires, interpreting radiographs, and what kind of data do we need to collect in order to come about at a diagnosis. Going back to the library, we're going to go to Module 2, and here we're going to look at what the diagnosis is, medical guidelines, what are the intervention strategies, understanding growth and development, and how to take that into consideration when you're looking to see what kind of intervention strategy you're going to do for a particular patient. Myofunctional therapy, TMJ growth and development, and here's our growth guidance protocol. And I'm just going to play a little bit of a sample so you can see what a presentation.
Pathophysiological factors interact with the upper airway collapsibility and anatomy ultimately determines the presence of or absence of obstructive sleep apnea and its severity. So it's about everything, and it's about the risk.
So that's what a presentation looks like. So you'll see the slide along with the person speaking, and this way it's an easier to understand format, easier to digest, because you can see both the speaker and the slide all together. Now going back into the library, going into advanced interventional strategies, here we go into the non-anatomical considerations for pediatric airway issues, vitamin D, endocannabinoid system, evidence-based treatment for expansion, protraction. So here we're going over literature. What is the available literature, and how do we understand what's happening during expansion, protraction? How do we treat retrognathic mandibles and functional tethered oral tissues? We'll go over treatment goals, the roles of the medical and dental specialists, and how the nose affects the airway. Now, in the bottom of each module, you're going to find this literature section. And here you'll find all the literature that we've used and referenced in all the presentation for that literature. So this way you have that as a reference also, and you don't have to go digging around in the presentation to try to find the citation. Now, Module 4 is what we do in order to hone in on the business. Building a referral base, the patient flow, billing for growth guidance, what kind of business models are available if you want to try to incorporate myofunctional therapy into your practice. And then we go over growing your pediatric airway component of your practice. Now, just like in our bodies, we have our heart and soul, but what gives it life is the breath. And the breath in the ASAP Pathway program is our implementation section. Our implementation is really what allows us to take the knowledge base that we've gained and really apply it into everyday practice so that we can help our patients in our community. Part of our implementation is the quick bite video, the video tutorials, myofunctional therapy hands-on videos, and Zoom meeting archives. The best thing about our implementation program, I think, is the team training program. And here are all the webinars that we do in order to train team members and get them up to speed. This is, I think, by far the most valuable piece in terms of implementation, because I find that there is nothing that can really skyrocket implementation of pediatric airway in a practice than training staff members. And, training staff members are easier said than done, just because a lot of times it's a time constraint, and also different team members are different parts of their journey. You might have a new team member, or you might have lost somebody and now you have another person jumping into that position. And it's hard to train team members, especially if all the rest of your team are trained and you have one or two members that need to be brought up to speed. So here in the team training webinars, we basically will train your team for you. So here, I think just here in and of itself, this implementation is going to be very, very worthwhile for your practice. Now, if you scroll down a little bit more, you're going to find the Document Center. The Document Center is divided into 4 sections: the patient instruction, physician letters, office forms, and patient forms. And here are all the forms that Tracy, Stacy, and I use in our practice. And in fact, a lot of these forms, we've taken the best of all 3 practices and we've put it together so that you're going to get the best of all worlds. So that is the Document Center. Now, I know that because there's a lot of material, it might be a little easy to get overwhelmed. But don't worry, this is all on demand and you can watch it at your leisure, and you can kind of find time in your day to try to fit it in. So I know that there are some people that fit it in during their commute. I try to fit it in while I'm working out, doing laundry, things like that. So, try to kind of incorporate it in your day and take it little pieces at a time. And that's why we've kept the videos at less than an hour. This way you can dive in and really digest the information just little chunks at a time. Now, when you finish a module or when you finish a presentation, in the bottom of it, you're going to find continuing education questions. So all of these presentations have CE credits available for them. We are AGD PACE certified continuing education providers. So you will be getting credits for these presentations. And also, if you have any questions and you'd like some interaction and some discussion, you can go here in this tab after each presentation module and click on it, and it'll bring you to our Facebook page. Now, the ASAP Facebook page is where our members kind of find their community. This is where we interact and we discuss things, everything pediatric airway related, from billing questions to what does staff do, during appointments to what kind of appliance do you recommend, to what lab do you use, all of that, including cases. So sometimes we want to look at laboratory reports and interpret them. Sometimes we look at clinical cases and get opinions from everybody. So these are things that a traditional study club really wouldn't be able to provide, just because it's hard to get people together in real time. But using the power of the Facebook site, we can get together pretty much on a daily basis and get input from many people in a matter of minutes. So I hope that you got a feel for what the online offerings are of ASAP Pathway.